Hi, guys. My name is Brandon Ayres, and I'm from the Cornea Service at Wills Eye Hospital and Ophthalmic Partners of Pennsylvania. And I'd like to welcome you to the Best Practices in Keratoconus Management podcast. Now, on this podcast, we're going to discuss a variety of topics surrounding keratoconus and collagen crosslinking. And we're going to reach out to experts across the country to get some tips and tricks and see what's worked and what's not worked for them in their practices. Now, today's topic is on the keratoconus quarterback. Who helps you keep track of your patients as you're getting them seen in the office and scheduled for surgery? Is that you, or do you have somebody in the office who helps you with that? Now, I brought in an expert today. Our expert is Dr. Priya Mathews at Center for Sight in Sarasota, Florida. Dr. Mathews attended Johns Hopkins Medical School, then did a residency at Columbia University, back to Wilmer for her fellowship. Now she's down in Florida practicing. So, Dr. Mathews, thank you so much for coming and spending some time with me on the podcast. Tell me a little bit about your practice, how you manage keratoconus, and how does collagen crosslinking fit into your practice?
Yeah, thank you so much for the introduction and warm welcome. I am so excited to be here to talk about this because everyone who works with me down here and my patients who have keratoconus know this is definitely something I'm quite passionate about. So my practice down here in Sarasota, I do cataract surgery, cornea transplant, and LASIK as well. However, I am the only one doing cross-linking in about a 40 to 50 mile radius. So that is a pretty significant population there. I trained in Baltimore and New York, as you mentioned, and what I've noticed in Florida, it seems like there's a very high incidence of allergic conjunctivitis and therefore a lot of keratoconus down here as well. I see it so much, or perhaps it's just I'm the only one doing it in the area, but there's a lot of those patients. I think we've talked about this before, the bandwidth, when you're doing all these types of different surgeries, it's hard with these patients because number one, the demographic themselves of patients with keratoconus, these patients tend to be younger and they're busy and they're in school or they're working. They may not have the resources to come for a consult or pay for the deductible. So these patients tend to be more likely to kind of drop off or get lost to follow up. And then on top of that, we have, just like you, we all have very busy practices. So how do we prioritize collagen crosslinking? How do we make sure we get the patient from our seat for the consult visit and then all the way through the entire process? And I really struggled with it in the beginning because when I was in training, the patient would just appear there for surgery. And I didn't realize all the steps that had to take place to get the patient to that step.
Yes.
And then I realized when I went on my own, I was mortified when I would see someone 6 months later. I'm like, you didn't get cross-linking yet? And I realized I need someone to help me with this.
So I remember that from fellowship like it was yesterday. Now, unfortunately, it wasn't yesterday. It's been now almost 20 years since fellowship. And we didn't do collagen cross-linking, but everything just falls into place. You're watching the attendings and it seems like magic. Well, now I am the attending, and we have 3 fellows following us around. And we're seeing, and I'm sure you are too, 40, 50, 60, 70 patients in a day. And it is a rat race. We're running from room to room. I don't even drink anything during the day because I don't have enough time to go to the bathroom.
Right.
Remember, exactly who I just saw. So, we see our patients and then I'm on to the next. And literally somebody may say, oh, do you remember what you wanted to do for Mrs. Jones? And I'm like, who's Mrs. Jones? I'm like, it's the that you just came out of, And that's not because I don't care about patients. It's because it's busy.
Right.
And I don't have time to organize everything during the day. So we've had to utilize office staff to help us organize our day. And, we have a surgical coordinator or a surgical counselor that does all of our, in the OR surgery. But how do we organize our patients for collagen crosslinking? Because I can't do it myself. How do you, or who do you utilize in the office to help organize these patients to make sure that from the time you see a patient and say, I think we should do collagen crosslinking, or I think it's indicated, to the time it actually happens, who does that for you? Who is that quarterback?
Yeah, that's a great question. So I've trialed many different things. So I have a surgical coordinator. Do you get the person who's scheduling LASIK and everything to be the one to do it? Do you have a technician do it? Is it someone who's non-technical and sitting at a desk during the day? Is it someone in billing that's helping you? And the system I have right now is what seems to be working the best out of everything I've tried over the past 5+ years. And I actually chose someone on my team, and this person's very important, someone who believes in the mission. I actually think that's critical. That person has to believe that cross-linking is important and understand why it's important and how if we're not on top of it, it leads to irreversible vision loss. Like you have to believe in the mission. So I think I found that that made a huge impact rather than having a desk staff do it. For my personal experience, that's what I found. And so it has to be someone who believes in it, knows what the numbers are, what's a Pennicam, like all the basics about keratoconus. And so I'm pretty lucky that this person that I chose, who you're going to meet, Mikelle, is also does all the workup, does all the refraction, and she is also a scribe, and she helps me with all my other patients as well. But she is the quarterback, the keratoconus quarterback.
And you sort of touched on this already, but what kind of qualities or characteristics are you looking at? And what does the chain of command actually look like? Is it just this, just your coordinator, or do they also interface with billing or somebody else in the office?
Yeah, great question. So I need there are a few characteristics. So passionate, of course, right? But then also someone who's very patient, because sometimes these patients are quite it can get frustrating. I mean, I can't tell you the number of times she calls them, do you have your medication? Do you have your medication? And then they show up for cross-linking and they're like, oh, I didn't pick it up from CVS yet, right? So someone who had that instinct to be patient, to be understanding, to basically move mountains to make sure that this patient gets cross-linking. So for example, I usually don't do cross-linking today. I do LASIK and surgery. But there was a patient today that was only able to do today, and it's not my normal cross-linking. And so Mikelle figured out a way to get me in between LASIK and surgery. And she figured out a room. Like she moved mountains in order to get this patient cross-linking, right? Because they're a 22-year-old, and of course, they have all these busy things, too busier than cross-linking, and that's what it feels like. And so I needed someone who was willing to think outside the box and then come up with ideas for me, and persistent and highly organized. I did have, I have had someone not as organized before in the past, and it can be disastrous because there's so many moving parts. Because as you mentioned, the whole billing aspect is huge. That I needed someone to be organized with where we are with each patient and each eye. Even sometimes the first eye is approved and the second one isn't yet. So where are we with each eye? So she really connects with one person in billing who's my billing champion, who knows everything in and out about it. So I found that by really having these two people as the champions, nothing was lost. Nothing fell between the cracks.
So I tell you, in our office, we do a very similar thing. And the person we were using as our quarterback was one of our technicians who had kind of moved up the ranks and was now a mid-level administrator. But she had been working with us with collagen cross-linking for a long time, even in some of the the pivotal trials and studies before cross-linking was approved. So she really knew it from the ground up. And she'd been a technician for a long time, so she could, she knew what topographies were and even how to read them, so she could really be an advocate for the patient. But I love what you said about the person who knows the intricacies of the schedule, because so many times these are younger patients very often, right? They're just getting started in their career, or maybe they're in high school or college, and they're like, well, right, I've got final exam, so I can really only do this on Thursday at 3. And you're like, oh my God, I'm like on a different, state.
Right.
So they've got to be able to sort of, depending on your schedule, but be able to read the clinical schedule and say, you know what, there's a little gap here, so we can tuck this patient in and get them treated.
Yes, that's exactly right. Yeah, it does take constant going over. Mikelle's going to talk about this later, but I realized we need a live document where multiple different people can look at it at any time, and we know what the status of every patient is. So that's kind of our main I don't know what quite the word is, but it's like it's a live document using OneDrive we do. and everything is on there. So also our person from billing can look at it at any time. Anyone on our team can look at it. And this is where she also keeps track of this person has not answered their phone. I've called them 3 times trying to schedule their cross-linking. And so we'll send a letter or something at that point.
Well, I love the idea you had about bringing Mikelle onto this podcast, because talking to the person who is this quarterback can be very different from us talking about the person who's the quarterback. Thanks for joining us. It's really exciting to have you on. I know myself, I lean very heavily on my technical staff to get a lot of this work done, and it sounds like Dr. Mathews does the same. So why don't you give us a little breakdown as to the role you play with your keratoconus patients, how you learn about them, how you track down their information?
Of course, yeah. So I always kind of go through the schedule for the week ahead of time. So I know who the keratoconus patients are who are coming in for consults. So I kind of keep my eye on them, and I get with the technician ahead of time, kind of give them any paperwork that they'll need in case Dr. Mathews refers, recommends cross-linking, and tell them the drops to schedule for the patient. So I make sure that the other, my other team members have what they need, going into it. If Dr. Mathews does tell the patient that they need cross-linking, then the technician will fill out the appropriate paperwork and then email it to me. And so immediately it is put onto an Excel spreadsheet, and that is my most utilized tool. I could not do my job. I could not keep track of these patients without my Excel spreadsheet. I have it color coordinated. It's broken down into, what eyes they're getting, which one's first and second, who the referring doctor is, and then if we're in the pending process, if we're scheduled, if we're complete, things like that.
So already, as this coordinator, you've done a lot of work, and it sounded like about some of these patients even before they come to the office, and that means your front desk must be tracking somehow so that when someone's referred, you already know they're coming in for keratoconus. Did I hear that correctly?
So I go through ahead of time. One of my side jobs I do for Dr. Mathews is kind of going through each appointment ahead of time and, making sure it's scheduled properly. So I kind of behind the scenes in that aspect of, seeing what's coming in, but that's beneficial for me as being the quarterback to, have a heads up that these patients are coming in.
Well, man, that's awesome. I'm also referral based, but we don't always have those notes. So it is awesome that you are tracking those down. And they're not that hard. Usually if I see a new patient who's coming in and that patient's 19, there's a good chance it's keratoconus, and we should look it up. So Mikelle, what kind of data are you looking for? How are you getting these charts prepped? Because there's so much that we have to look for. Because really, when we're talking about collagen cross-linking, it is for progressive keratoconus. So are you trying to track down records if they're not there? I'm trying to learn so I can put more heat on my quarterback and get her to work a little bit more like you.
Absolutely. So referring doctors are put into our scheduling system. So ideally, in the perfect world, I can go in there and see who the referring doctor is and ahead of time request records if they're not already in there.
So where does your role start and finish? You start early on, before the patient even gets there, tracking down records. You're tracking them, making sure that they're getting their authorizations for right and left eye. And then does that go into the procedure room as well? Do you help get the procedures done?
I do. I assist Dr. Mathews with the procedures.
So you see these patients, and I guess you understand the mission, right, Mikelle? You see them.
Oh, absolutely.
When they come in, the turmoil of sometimes getting them, approved and scheduled right through treatment, and I would suppose follow up as well.
Absolutely, yeah. So I build relationships with these patients. I care for these patients. They become my friends, I think, and I help them get their post-op scheduled. I'm calling them the day before, reminding them of their appointment, confirming that they have their drops, which, as Dr. Mathews was talking about earlier, there are many times where the day before I'm calling 3-4 different pharmacies around where these patients live to try to find a pharmacy that has this drop for them because they need it for the next day. But it's so important that life happens and I understand it. So I just be patient and I try everything to help get these patients the drops they need for after cross-linking.
Thank you so much for your time and coming on and all the work you do for keratoconus patients there in Florida.
Absolutely. Thank you so much for having me.
So with all the work she puts in, there's got to be some key benefits in the practice to having somebody doing all this work, especially versus you. There's no way that you or I could do all the work that she does. I mean, there's just not enough time in the day. So what have you seen as you've employed this keratoconus quarterback for your cross-linking practice? What have you noted in the office as far as patients following up, getting approvals? Yeah. What does it mean to you as far as treatments being done?
It's everyone who comes in gets a treatment unless they have really dropped off. And if they did drop off, we have called them multiple times. We have everything documented and we send a letter as well. And that occasionally happens. But now I'm just seeing that things don't fall through the cracks. And with her and our one person in billing, it's just been a game changer. Like everything has been done timely because they understand the urgency. Like it's not like cataract surgery, you can wait another 3-4 months.
Right.
This is something that we need to get done now. And I find it so critical that they understand that part of it. So I'm just seeing like people who come, somehow they get it. And that's really, I have to thank Mikelle, because like you said, I could never do it myself. And I had to go through a lot of struggles and finding a streamlined way to do it, especially in the billing side of it. But I've worked at 2 different practices now. In both places, I really initiated and started the cross-linking process. So it was a lot for the billing department to learn in the beginning, but we created a protocol, and I'm a huge fan of protocols in these situations because then where everyone knows what's next.
Yeah, I think you have to define those roles. We find that also. And I mentioned kind of my story about when my coordinator was asking me what was going on when I thought she knew what was going on. And clearly for a little while, nobody knew what was going on. And I could actually see, I'm like, geez, I'm usually doing a couple cross-linkings on Friday, and I didn't do any this Friday. What's going on? So I can see a drop off when people aren't following those protocols and they're not doing or don't know to do what they're supposed to do. And we see an uptick when they do. So I think we're much better at getting those patients. And I can only speak for myself, but we're much better at getting those patients treated timely. And we can treat more patients when we're following those protocols and that quarterback is comfortable in that job role. Now, a challenge that we have is sometimes collagen cross-linking isn't that fun. It hurts. Patients forget, right? And they do well. And we've had great success with our cross-linking program. But you got to remember that patients have 2 eyes, and they usually have keratoconus in both eyes. And getting that second eye done is really, really important. What tips do you have, or what have you seen in your own practice to help ensure that we don't stop at cross-linking the bad eye and forget about the less severe eye, getting both of them done?
Yeah. We try to schedule both ahead of time. So if I know both eyes are going to be done, then we decide, before the first cross-linking procedure, we put both on the schedule, which I think is huge. We're not going to wait until the first one heals. We want both definitive dates, post-op appointments, everything is made. Another point is that we try to get these patients in during the 3rd quarter because of their deductible. So they've already spent that money for the first eye. We would like to get them, and we tell them about this. You might as well get it done before the end of the year. And that again encourages them to hopefully move forward with the cross-linking as another incentive, because many of these young patients actually have high deductibles. So it does make a difference.
Yes, no, I totally agree. And we see the same thing. In fact, even today I had a few patients saying, you know what, by the time we get this done, it may be next year. I've already paid $5,000. Let's get after it and get this done. So good point. Money talks sometimes when it comes down to getting things done.
The pain control, that is a kind of big deal for us. It's interesting. I really try not to prescribe opioids because, I don't want to contribute to the crisis that there already is. And I try to do Tylenol and Motrin alternating. That's what I usually tell patients. But in some situations, if I think they need it, I will do like a very small amount of Percocet if needed. But just to get through like the first 1 or 2 days. But really, most of my patients will do just Motrin and Tylenol and they do okay. But I think that is important because we don't want the first experience to be traumatic, that they don't come back for the second one. And I think the education about the importance of cross-linking the good eye, like we have to actually explain what we're thinking. Like, if you want it to stay this way, we have to do this. Otherwise, I can only keep you as good as you are at the time of cross-linking.
Yeah, I actually have patients, and I'm similar to you. I don't love prescribing narcotics, but epithelium off cross-linking does cause some discomfort, and so I'm not unwilling to give them 5 or 10 Percocet or Tylenol 3, and you just need to get them through the first night or two, and then they're fine. And in those very nervous patients, we'll also use some conscious sedation in the office. We use the Mikelle melt. So they don't even remember most of the procedure itself. And that's been really helpful because they don't have much memory of what's going on. They stay reasonably comfortable at home, and it helps us get that second eye done. Because I really want to get both eyes completed within 2 or 3 months. And we have patients who actually come to us and say, hey, I've healed up from the first one. When am I getting the second one done? You're like, wow, if you're asking for it, then it must have really been a relatively pleasant, experience for you. So, and pain management is so important. Patients are not nervous about the procedure. They're nervous about discomfort. So if you can alleviate some of that and calm their nerves, I think it really helps in getting that second eye treated. Priya, Mikelle, thank you so much for your time and expertise. I personally have learned a lot, and I've learned some tips and tricks that I want to bring back to my own practice. I think we're going to have a pretty busy partner meeting this month talking about how we're going to change our keratoconus protocols. Once again, thank you so much for joining me on our inaugural podcast on best practices in keratoconus management. Hopefully you've learned something that you can take back to your own practice to improve your cross-linking practice, find your cross-linking quarterback, or maybe just improve your clinical skills at managing your keratoconus patients. I'd also like to thank Glaukos for helping support this podcast. Thank you so much for listening. I'd like to thank Dr. Priya Mathews and Mikelle for such a wonderful episode. And audience, please provide your feedback through the link in the description below. Thanks again, and please stay tuned for another episode of Best Practices in Keratoconus Management coming your way soon.